Hello everyone and welcome to our What's New in Wiser Health webinar series. This ongoing series helps provide you updates with the latest information about the last few releases and keeps you abreast of changes to the tool so that we can invite you to join both our product community here at Wiser and help us advance the product. Before we go any further, I'd like to review the functionality of the GoToWebinar. Right now I have everyone on mute to avoid background noises that may distract you from listening to the webinar. However, during the second half of the session, we'll want to hear from you, so please enter your audio PIN if your audio connection is via telephone so that we may unmute you at the appropriate time. If you do not see your audio PIN, just right-click on your name and you can request another audio PIN and we'll be sure to send that to you. We also want you to participate during the first part of the session as we review the enhancements of the product. So throughout the presentation, there will be interactive polling to obtain real-time feedback, so please join in and answer. We will also be managing the chat functionality, so you may enter a question at any time or your comments throughout the presentation, and we'll be sure to address them as we go along. We'd also like to let you know that we are recording today's session and hope to make it available for you to replay for you and others who were unable to join us today. So I've had the pleasure of meeting some of you, but I can see that some others who are joining us for the first time, so I'd like to take a moment to introduce myself. My name is Carol Harris. I'm the Director of Product Management here at WiserTogether, and managing the session with me today is Kate Jennings. So as I mentioned, some of the goals of my session here today is that by the end you'll have learned more about how the product has improved over the last couple of releases since we last had our last update in the spring, but also that you can become part of our product community here at Wiser to help us advance the product and drive the initiatives that we want to focus on in the upcoming releases. So let's begin. So we have an audience today, including clients, partners, and others. Let's take a poll to understand the depth of understanding that people might have about the product. So we're going to launch our first poll.
All right, everyone. So we're going to launch our first poll. And the question is, when did you last log into Wiser Health? So if you could please submit your responses. And let's see here. We've almost got everybody participating. Just a couple of more people. All right. Let's see here. All right, great. All right, and here are the results. So as we can see, we had people log in to the tool in the summer, and some folks still haven't logged in, but hopefully once we get through with the webinar, you'll see some of the great functionality that we have to offer, and we'll get you in there.
Great. So as we go through the presentation, we'll be sure to call out some of the basic functionalities of the product as well so that we can ensure that people get the most out of the session. So a couple things that we want to get you up to date on is, as you may know, Wiser Health is a SaaS-based product and you get releases every 6 weeks, and you can always find information at our help center at wisertogether.zendesk.com, including our release schedule. So in our last session that we had, most of our clients mentioned that they prefer to receive communication via email. So as a client, you should be receiving the What's New notification, providing you a high-level summary of some select key features the week prior to the release. If you're not receiving it, please let your account manager know so that we can make sure that you get on the appropriate mailing list. But for a complete list of features of what's in the release, please check out the release notes available at the Help Center. Our next release is coming out on Tuesday, September 15th, and there'll be some exciting new enhancements, so please check it out. In addition to the release schedule, as a client, you can also access additional documentation such as engagement collateral, onboarding and information security documentation. We also like to let you know that there's some updated videos available to help guide users through the tool. So if you look under the Wiser demonstration video article, you'll be able to see 2 new videos, one about getting started with Wiser and one specifically going into detail on how users can explore treatment options and what the information would mean. Okay. So as we go through our releases, we have some key themes that we continue to focus on, mainly around usability, security, and integration points. So at this point, I'd like to jump into the system and share some of the exciting changes. So I'm just going to log into the system so that we can have access to our system. So first and foremost, we want to make sure that users can always find the treatment and conditions they're seeking, but oftentimes they don't know what they're searching for, or if they do, they don't know how to spell it. So we've made a lot of enhancements around the ability to find and get to a condition. For example, we've introduced a phonetic search, so if I type it incorrectly, I will still get information about diabetes. It does a phonetic search, and it brings back search criteria that might match that. We support synonyms. So now if a person happens to be looking for something like deep vein thrombosis, they will still be able to find it even though we have it categorized under blood clot or thrombosis. So they're able to navigate that way. And in addition to that, they can also search for information about treatments. And when they do, they can see a group of conditions that may be applicable for that treatment. These are all changes to help drive users to help find the treatments and conditions that they're looking for so that they can take advantage of the tool. We've also introduced an enhanced navigation. So once they're actually within a particular condition, I can see that I'm in carpal tunnel, they have this navigation bar that persists throughout. So when I want to learn more about carpal tunnel, I can get my article about carpal tunnel and look to see what information is there. So this navigation on the right-hand side also allows the user to navigate quickly to parts that they might be looking for, such as questions to ask your doctor or back to what is carpal tunnel. We've also introduced and begun our integration with HealthWise. Articles such as this one right here about carpal tunnel can be seen to be from HealthWise as a reference source here. So you'll always know that it's up-to-date information, and we stay abreast with their quarterly updates so that the information that you see on the site is up-to-date and reviewed. We also have the ability for several of the information within the articles to have definitions. So if you don't know what a tendon is, you can get a nice little pop-up to tell you what that definition is, and you can navigate back to the article or just simply close that so that the user isn't taken away from the main information that they're looking for. And in addition, as we know that all the users don't use the system in the same way, we give them multiple ways to get to the same place that they want to be going. So our next step is really, once they learn about a condition, is to explore their treatment options. They can get to it from their top navigation, from the right-hand side, or if they're reading about the article, once they get to the bottom, they can also explore treatments there. And as you can see, the navigation persists throughout the system to keep the user engaged so that they know exactly where in the system they are. So once we get to the Explore page, we've made some major enhancements here. First and foremost, and most noticeably, would be our patient ratings. We've changed that to a more consumer understandable standard. Rather than have the satisfaction and patient effective rating as two separate items, we've combined that into a simple to understand star rating, and have also provided the number of responses that we've collected for that treatment so that users can make a better educated guess about how they'd like to weight those responses. Any responses below 25, we will record as not enough responses available because that is not statistically significant to provide a result. We've also included a better way to manage or interact with the people like me. So they can answer questions, and as they continue to do so, if maybe I'm just turning, 30, between 35 and 36, so I can answer the question, I can refine the result, or if I'd like to go back, I can undo it and select a different option. You'll also notice that we've added checkboxes to make it clear that users can filter by any of the information that they want to focus on. So if I only want to focus on what's been found effective, I can see my two options. And then once they've narrowed down their results, they can actually select treatments to compare side by side. As I mentioned, there's still, again, multiple ways to do that. They can compare now here, they can compare at the bottom or the top of the screen. So if they happen to be looking at all theirs, they've got multiple ways to navigate to the same place within the application. Once they're at the point of comparing, they can see their treatment options side by side, not just what people recommend, but also the typical person, and if the information is available for medical professionals. They can see the clinical evidence ratings, the information about cost and coverage, and as well on the overview of that particular treatment and portion of it. Once they're actually interested, they can actually come back and learn more about just that specific treatment. And again, that navigation carries throughout the system, along with the right-hand side, which allows them to navigate to specific information that they might want to be looking at, such as eligibility and cost, or if they want to go back to their treatment options, they can go back. So most of our enhancements have been focused on the usability and how we expect users to interact with the system. At this point, I'd like to speak about a few optional enhancements that we've introduced into the system. So I'm going to jump back into the presentation. And if you've allowed us to communicate with your end users, we may reach out to them to gauge your satisfaction with the tool. So to date, we've received some responses, and so far it's been about an 83% satisfaction rate across the application. There are also a number of configurations available around password strength, history, and the user validation message. So a configurable password is introduced such that our standard password requirement is 6 characters long. However, if your organization chooses and employs a more strict policy, you can configure the number of characters it requires, or if a special character, uppercase, or number is required. You also have the ability to set whether the same password can't be reused for a period of time. So this way we can ensure that the security on the password aligns with what your organization might be doing. Also, uh, to configure the text to provide the user better information about what they're inputting. So remember, if you want to take advantage of any of these optional configurations, such as password strength, history, or the user validation message, talk to your account manager to get these scheduled for configuration. So we hope you've been pleased with what you've seen with the product thus far. And now we want to do a quick poll again.
All right, everyone, so we're going to jump into another poll, and we'd like to ask, of which features were you aware of? So our improved search, enhanced workflow navigation, comparing treatments, and the HealthWise content integration. Let us know by submitting your responses now. Just need a few more responses and we'll close the poll shortly. All right, and as we can see, half of you knew about compare treatments, and not everyone was aware of the enhanced workflow navigation, but hopefully now we've provided a good overview for you to inform your users about that.
Great, so now that we've shared what we've done in the last few releases, now let's share about what we're planning to do with our roadmap. So, as with always, when we talk about our roadmap, we would like to share our disclaimer because it's kind of our future vision of what we expect to do, but we can adjust that based on priorities, market evidence, and client input, especially as you provide that here today. So when we look at 2015, we've done fairly well on what we've planned to do so far. That we have made some adjustments based on our last session that we had with the group, and we'll share that in a moment. But as we look for the rest of the year, we do want to continue with other items around system security. We're going to continue to focus on usability. The things that we've shown thus far have been just the initial components. And in addition to that, we want to introduce what we're calling health news content. So we've partnered with a vendor called HealthDate so that we can introduce new health information on the site continuously to ensure that users have fresh information available when they're interacting with the site. And in addition to how we're doing the satisfaction loop, we also want to ensure we can reach out to our end users to get some of their information on their treatments and how they felt about their treatment. So we'd like to introduce a user feedback loop using that same mechanism. As we look towards the end of the year, we're looking to see and introduce integration with a cost transparency vendor so that we can enhance the experience for cost data and provide more information. We're also going to look to expand upon the information that we've captured in the survey and how we can present more of that information to end users. We also want to continue to focus on usability to help drive users to certain parts of the application that they may not be aware of. So we're looking to see how we can ensure that they have even more feedback about here's where the next activity might be available for them to do and look at. And then also have the user provide feedback upon the product. When we look at 2016 and the year following, we want to increase the amount of information we have about medication information. So medication tends to be one of the popular options within the treatment list, and people are often looking for information about medication. So we're going to look to partner with a third party to bring in more detailed content on medication. And then from a usability standpoint, we're going to look to see how we can better share what those users are looking at or considering with caregivers. We're also going to look at introducing new conditions, especially around the digestive and oncology areas. And then we're going to also be looking at how we can capitalize on the information that we know about users when in a user profile to help better personalize their experience with the tool. So now that I've shared some of the plans for our roadmap, I'd like to launch another poll so that you can better understand what your drivers are.
Great. So our next poll, we're going to ask you which enhancements would benefit your organization the most. So we're looking for answers related to Spanish language in the application, a native mobile app, access across a mobile phone, integration with other vendors for cost transparency and telemed vendors, and custom configurability. So please submit your responses now. All right, great. And we can see here a lot of you are interested in access via mobile phone, and we also have interest in custom configurability as well.
Great. So now we're at the point that we want to hear from you. So we want to hear about what you might want to see in the product, what you might like about the product, or particular issues that you might be having with the product. So just to share, when we last met in April, we asked what features you would like to see most in the product. And as you can see, compare treatment side by side was the far winner. And what we did was we reprioritized our work and focused to ensure that we could introduce that compare feature that I demonstrated just a little while ago. So I'd also just want to launch one more quick poll. The other enhancements we talked about were things that we wanted to see in the product, but also what features specifically we might want to look at. So I'm going to launch one more poll.
Great. So our last poll would be, what feature would you like to see in Wiser Health? So we're looking here for your responses regarding sharing information with the provider and caregivers, expose more survey information to the user, provide more in-depth educational material to the users, and if you have any other suggestions, we would love for you to submit them in the chat window so that we can discuss them later in our Q&A portion. So please submit your responses now. And again, just a reminder, if you selected the other option, just please submit any ideas that you might have in the chat window. We would greatly appreciate them. Okay, great. So we can see here, half of you are very interested in sharing the information with provider or the caregiver. And we're also seeing an interest in providing more in-depth educational material to the users. So thank you for your responses.
Okay, and I don't think we saw that there was too much from the other responses, but what we can share. So now it's time that we'd like to hear from you and have an open conversation. So again, if you're connecting via your telephone, please enter your audio PIN so that we can unmute you. And if you'd like to be unmuted, please just raise your hand. And this will begin our question and answer session, as well as any open discussion that we might have.
Carol, so it looks like we did get a submission, by the way, for the other features that people are interested in seeing in the application. Perhaps a video library from HealthWise was what someone had submitted for the other.
Great. And if anybody would like to be unmuted, please just raise your hand. Or if you have any questions that you'd like to submit, please just enter that in your questions window and we will look to address that.
Carol, it looks like we got a question in our chat window. So the question is, how often is the survey data updated in the application?
Oh, great question. So we are constantly gathering survey data, but currently the survey data is updated in the application currently with the release. We're trying to work to ensure that we can get more real-time updates to be live, but you'll notice within our release notes, we do point out the number of data points that we've collected between the period of the release and that was updated with the release. So if you're interested, you can always look at the release notes. There's a specific section about data, and that includes all the survey information that we've captured within the period between the releases.
Great. And then we have another question here in the chat window, Carol. How many features can you compare?
Great. When you're looking at the compare feature, you can compare up to 3 treatments. When we looked at how many treatments typically people evaluate, that seemed to be a reasonable number because any more than 3 tended to be overwhelming, but less than 3 wasn't useful. So oftentimes people will narrow their choices down, and today they can see up to 3, they can select 3, and it shows them that within the application.
All right, Carol, and then we just have another question here. It's another data question. So how do we get the data from the feedback loop? And also, is there any additional information in the feedback that can be captured?
Sure. Currently today, we actually look to see whether as a client, you've allowed us to reach out to your members. If you have, we then look at the member to see if they've been on the site and if they've been on the site for more than 2 minutes, because anything less than that probably means they didn't really use anything on the application. So we've put in some qualifiers to make sure that we're going to get some decent responses. But we ask them a simple question from 1 to 5, are you satisfied with your experience on My Wiser Health? And then if they happen to say that they're not satisfied, we do ask them an additional follow-up question such that it is, what can we do to improve? So today we've had only one response towards that negative, so which is why we're at our 83 percent satisfaction. But the one response was mainly around their inability to find the condition that they were looking for. And so we take that into account as we're prioritizing things and what we want to do. And so that was actually something we obtained before we introduced some of the search features that we've been doing. In addition to that, when we look to the feedback loop, where it's all right now going through an email. So as long as we have the email of the user, we'll reach out via email, and we're using a survey system to capture that information. Great. Are there any more questions? Okay, well then we are going to launch one more poll, which is we want to look to next year to start a user group where we can actually have an open forum for discussion. So we will separate what we're doing here rather than do a product update along with a discussion about the product. We'd like to form a user group of sorts so that you can help shape the future of the Wiser Health product and as well collaborate with your peers. So we're just going to launch a quick poll of would you be willing?
All right, everyone. So our last poll, we're just asking if you'd be willing to be part of our user group. So yes, no, or not applicable for your responses. And please submit them now. All right, great. And here are the results. So we'll be getting in touch with those of you who will be interested in being part of our user group. And thank you again for your responses.
Okay, well, that concludes our session today on what's new with Wiser Health. We want to thank you for your participation and hope to see you in the future. We will be sending a quick survey out after this conclusion, and we will be posting this recording on our help desk for replay or if you want to share it with others. Thank you again.